Okay, so today I'm going to be pulling up some meds for a patient named Martha May. This is my first time checking the MAR and pulling up the meds. So what I'd first do is wash my hands and then put gloves on. And then it looks like the first med that I'll need to pull is fluoxetine. The dose that we have ordered is 60 milligrams. What I have available is 20 milligram per capsule. So I'm going to need 3 capsules today. So the first thing I do when I pull the med is make sure that the expiration date is valid and that the medication doesn't look like it's been tampered with. They all seem consistent, so I'm going to be good to administer those. The next thing I'm going to do is get her insulin mixed. So I have an order for 2 units of NPH. And 10 units of NPH and 2 units of regular insulin, and the expiration date on both of these are valid. Since I'm going to be pulling from the vial, I will first clean the tops of both. And the insulin needles are already attached to the syringe. And I don't have a sharps container right now, so I'm going to grab one. I'm not sure if I can pull this. Okay, I do have a sharps container. It was just on the other wall. That in the trash. And then for insulin, I'm going to be sure to mix. First, I'll inject air into my NPH, the cloud unit, after I've rolled it. So we need 10 units. So I'm first going to inject 10 units of air. First. And then I'll do 2. And I'll have to make sure I'm super accurate because it's a pretty small number. Into my insulin. And I'm going to go ahead and draw the 2. And now I'll pull an additional 10 units. So when I get ready to inject, I'll have a total of 12 units that will be injected. Okay, so my insulin's drawn up. Make sure to cap it. And then I'll label that it's correct. It has her name on it as well. And then the next thing that I'm going to be injecting is ceftriaxone. And my ceftriaxone is a medication that's going to need to be reconstituted. So I'll check first my expiration date on the ceftriaxone, and it is valid. And then this is the solution that I'll be reconstituting with. It's also not beyond the expiration date. So I'm gonna go ahead and clean both of these. So for the ceftriaxone, I have ordered to administer 0.5 grams. And then what I have available is 350 grams per 1 ml after it's reconstituted. That means I'm going to be administering 1.4 ml today to get her the correct dose. So I'm going to use a 3 ml syringe to administer this. Okay, so first I'll need to pull 2.1 ml of air. And then pull the 2.1 ml from my vial. Making sure there's no air in there. And got the air out, and just a little bit more. So now I will be reconstituting the ceftriaxone. And while I'm setting that down, I'll need to cap that really quick. I think I put that in here. And then when reconstituting, I just have to make sure I don't shake it. Just rolling it in between my hands. Making sure there's no clumps. And that looks pretty good. I'll just be pulling 1.4 ml from this to inject, so I'm going to inject 1.4 ml of air. And then I'll go ahead and pull. Right, 1.4. So I'll cap that and that air bubble to the top, and then I will get rid of the air. Recap. And now I'll go ahead and label that ceftriaxone. And then it looks like the last med that I'm going to be drawing up is cyanocobalamin. It's right here. The expiration date is valid. Going to use another alcohol wipe. These are clean each time I grab one. for the ceftriaxone, cyanocobalamin, I'm going to be administering 200 micrograms, and what I have available is 1,000 micrograms per mil. So I am going to be administering 0.2 mil. And it's a pretty small amount, so I'm just going to be using the smallest syringe that I had available, which is a 3 mil. And then normally I would be using a 22 to 23 gauge needle, about 1.5 inches, but all I have available is a different size. Okay, so 0.2 mil. To be super precise on this. So I'm going to inject my air into here. And then pull just to 0.2 mil. Pull a little extra because I have a bubble. We're at 0.2 now. Label that. And then lastly, we have a TB test that we're going to be doing for Martha. So I'm going to grab the Tubersol that I'd be using for it. It is not an expired vial. And then I will just be cleaning that with another new alcohol pad. And then the TB test syringes already have the needle attached to them. So I'm going to put on the new needle, and I'm just going to be putting in 0.1 ml of air. And then I just pull 0.1 ml of Tubersol. And I'll go ahead and label that too. Okay, so I have all of my meds drawn up. I'm just going to check the MAR for a second time after I have had everything drawn up. So fluoxetine for Martha May, 60 milligrams, 3 capsules. I have my insulin drawn up. I did both doses in one, so we don't have to poke her twice. I have my ceftriaxone, 1.4 mil for Martha May, and my cyanocobalamin, and my Tubersol for my TB test. And then I would have a second nurse come in and just validate that all of my dose calc is correct and that the medications are what's on the MAR. So I've completed my second check. I'm going to take my gloves off, sanitize, and then go ahead and take these meds to our patient. Hello, my name is Tanisha. I'm going to be your nurse today. Can I have you confirm your name and your date of birth? Okay, hello Martha May. Your date of birth is, going to match up with what I have on your MAR, 9/12/1949. Can I also just validate that on your wrist bracelet? Awesome. Okay, Martha, how are you doing this morning? Good. I have your round of your morning medication. It looks like they're all set to be administered between 0730 for your insulin and everything else at 0800. And it's right at the 0800 mark, so we're going to go ahead and administer those if that's okay with you. Okay, let me wash my hands really quick, get some gloves on. gonna provide you with a little bit of education, and then we will get going, okay? So I'm gonna wash my hands. I'm also ensuring that my patient has privacy. We do. Get the gloves on. So far I've confirmed I have the right patient. It's the right time. We do have the right medications, which I'm just double checking again before I'm going to administer. Cyanocobalamin, Tubosol, ceftriaxone, insulin, fluoxetine. I do have the right doses. I'm double checking that one more time. 60 milligrams, a total of 12 units of insulin, 10 NPH, 2 regular, ceftriaxone 1.4 mil, Tubosol 0.1 mil, and cyanocobalamin 0.2 mil. So I have the right dose. And then gonna double check that I have the right route as well. So fluoxetine is gonna be administered orally. Insulin is gonna be sub-Q. Ceftriaxone and the cyanocobalamin are both IM, and the Tubosol is an intradermal. So the right route as well. So right patient, right route, right time, right dose, right medication. I'm gonna be sure to document when I'm done with this. But right now I'm gonna go ahead and provide some medication. Okay, Martha, so the first med we're gonna be giving you is fluoxetine. This is your antidepressant. The only thing you might experience is maybe a little bit of drowsiness and a little bit of fatigue. Are you okay to administer this orally on your own? You are? Okay, great. So I'm gonna give this to you with water, and she took that just fine. I'm gonna offer her another drink after she has taken the medications. And it is 0801. Okay, now we're going to give you the insulin. The insulin is for your diabetes. I just want you to keep in mind that insulin injections are not a cure to diabetes. It's just a way to help manage the disease. So we're still going to encourage you to stay with the diet that your providers recommended and to stay as active as you can. The only thing you might experience with insulin is just maybe a little bit of pain at the injection site, but nothing out of the ordinary. It looks like it was administered on the left side the last time we administered it. So I'm going to be sure to give it to you on the right side, 2 inches below the belly button. I'm going to grab my wipe really quick though. And before I inject this, and in between each injection, I'm going to be sure to clean the area. So again, this would be going 2 inches opposite of the last injection. For sub-Q, you insert at 45 degrees, and I do need to squish the area. And then it does have a safety on top. Put that on. Dispose of that in the sharps container. Okay, the next med that I'm going to administer is ceftriaxone. The ceftriaxone is for the UTI that you have. This med is going to be administered intramuscularly. It's 1.4 mil, so I'm going to do this in the ventrogluteal just because it's a little bit more than normal. But this is for your UTI, and the side effects that you might experience is you might feel a little bit more tired than normal. But again, nothing out of the ordinary. If you have anything beyond that, just be sure to let us know. So to identify the ventrogluteal location, I would turn Martha on her side. So I'm using her right ventrogluteal site, so I use my left hand. Right, that's right side. And locating this way. I would put it right here in this location. That'd be the ventrogluteal area. And reposition it. And I'm going to wipe down the area with a new alcohol swab. And then IMs, you just give them at a 90 degree. Take my safety needle off. Dispose in sharps. Okay, so the last injection is the cyanocobalamin. And cyanocobalamin is for your vitamin B12 deficiency. This is a pretty tiny dose. It's only 0.2 mil. So I would give this in the deltoid, which is going to be about 3 fingers length from the top of her shoulder. So about this area. Again, this is for your vitamin B12 deficiency. This side effects that you might experience are just a little bit of pain at the injection site. It is a pretty small dose, so it shouldn't be anything too crazy. You're okay with that? Okay, great. So again, I'll just wipe down the injection site. It's IM, so again, 90 degrees, 90 degree angle. Get rid of that. And then lastly, we are going to be doing a TB test. Let me mark when I got all those injections as well. Insulins were at 0.02. Okay, so we're going to be doing a TB test. Are you familiar with what that is? So it's a method that we use to test for tuberculosis. So I just gave you a small injection. It leaves a little bleb in the middle third of your forearm. To complete the test, though, we do have to have the results read within 48 to 72 hours. So we'll have you just, if you're still in the hospital, we'll just follow up with it. If not, we'll send you a reminder to come in and get that read. The only side effect you'll experience with this is just a little bit of bleeding at the injection site, but it is pretty painless. Is that okay with you? Okay. So I'm gonna wipe down the site. And then, so for TB tests, we just have to be really careful and make sure the bevel side is facing upwards. And then you insert intradermally at about 15 degrees. And then inject to form this little bleb, like that. Cap my needle. And get rid of that in the sharps. It looks like we got that done at 08:05. Okay, Martha, great job. I know that was quite a few pokes today, but you did great. Do you have any questions for me before I clean up and head out? Okay, well, you let us know. Just take your call light if anything comes up, and I'll be back to check up on you when it's time for your next meds.